Osteoarthritis is a joint disease where there is a progressive softening and degeneration of the joint cartilage. It is a common knee problem, especially for the middle to older age group. These exercises will help to strengthen your leg muscles to stabilize your knee joints, thus preventing your knees from giving way and reducing the risk of falls and pain. We recommend that you consult a doctor before starting any strengthening program. Do not continue the exercises if you experience any pain or discomfort. Single leg balance. In this exercise, you will need to hold on to a sturdy surface such as a table or the back of a sofa or chair. Let's warm up by marching on the spot for 1 minute. When your body is all warmed up, slowly begin by lifting one leg and hold for 10 seconds. Next, repeat this exercise by switching legs. Let's hold this for 10 seconds. The goal is to stay balanced as long as you can. You can increase the difficulty of this exercise by using only one hand to support yourself or by closing your eyes. You can repeat this for up to 10 repetitions for each leg. Semi-squats. For this exercise, you will need to hold on to a sturdy surface like a table or the back of a sofa or chair. Slowly start by lowering yourself into a semi-squat position. Then straighten up slowly. You can repeat these for up to 10 repetitions. Sit to stand. Let's practice this move to make standing easier. You will need a chair for this exercise. Sit with your back straight, feet flat on the floor. Use your leg muscles to slowly and smoothly stand up tall. Then slowly lower again to sit. Ensure that your bent knees don't move beyond your toes. Try with your arms crossed or loose at your sides. If this is too hard, you can add pillows or use a chair with armrests or push yourself up with your arms. You can repeat these for up to 10 repetitions. Knee straightening in sitting. In this exercise, you will need to remain seated. These will help build muscle strength to support your joints. Start by keeping your feet firmly on the floor. As you raise one leg, tighten your thigh muscles. Keep this leg straight, toes pointed up, and hold for 10 seconds. Keep your thigh muscles tight and slowly lower your leg slightly before raising it again. You can repeat these for up to 10 repetitions for each leg. It is recommended to incorporate these exercises into your rehabilitation program. We hope that this video has been useful to you, and we wish you an optimal recovery.